Coronavirus metrics are on the rise here in Maryland. The latest stats, a positivity rate above 6% and more than 300 Marylanders in the hospital with the virus. That is up 36 from yesterday. COVID-19 cases are on the rise in the state, including right here in Baltimore. The city's health commissioner is now strongly recommending that we wear masks indoors to limit the surge. Earlier tonight, WMAR 2 News' Ray Strickland spoke to a Johns Hopkins doctor who is encouraging us not only to wear the mask inside, but to also make sure you get that vaccine and booster.
This virus is not going away.
2 years later, and COVID-19 is still alive and well, but Dr. Panagis Gilead-Santos from Johns Hopkins says there's a big difference in where we were then compared to where we are now.
We have the weapons to prevent life-threatening versions of COVID. Yeah.
He says the vaccines have proven to work against the virus and its variants. He also says masks have been effective at helping limit the spread. And with cases on the rise again, he says those measures will be important to handle another surge.
It is a germ out there. It's not going away. It's becoming more and more contagious. And you just have to understand, what would it mean if you catch it? How would it disrupt your life?
The statewide positivity rate is now above 6%, with the state reporting more than 600 new cases. But hospitalizations remain low, with a little more than 300 people currently being treated for the virus. In Baltimore, the city's health commissioner, Dr. Letitia Daraja, said COVID cases in the city rose over 243% in the past 28 days. On Twitter, she posted about getting the vaccines as she strongly encouraged people to wear masks indoors. It's worth noting she did not issue an indoor mask mandate, and Dr. Gilead-Santos agrees with that decision.
From their standpoint, I think they want to be safe and not sorry if these high community cases do break through and ultimately result in hospitalizations.
He attributes the rise in cases to people wanting to get back to a sense of normal, but he also says to not lose that, it's going to be important to continue taking the virus seriously.
Face masks work. Continue wearing the face masks. Continue having home tests to test yourself if you have any concerning symptoms for COVID.
And that was Ray Strickland reporting.